Yeah, I'm so excited to have back for the second time on this podcast, Dr. Kara Wada, to talk about
Hello.
Sjogrens. It's something we haven't done like a whole episode on it before. So I'm so glad you're here. Can you tell the audience a little bit about where you live and what is your relationship to arthritis or rheumatic disease?
Yeah. So, hello, and thank you for having me back. My name is Kara. I live in Columbus, Ohio, which is where the Ohio State University is located. I work at the university. I am a practicing allergy and immunology physician. So, I do see some patients who have what I lovingly refer to as misbehaving immune systems. More often, I am leading kind of treatment plans for people who have allergies, as the name would imply, but also immune deficiency. And one of the really obnoxious things about the immune system is it's not infrequent that folks who have allergies and or especially immune deficiencies are more prone to developing autoimmune conditions, and in particular, inflammatory arthritis, which is RA. And I was diagnosed with systemic Sjogren's in spring of 2019, which was both a surprise, but also some validation for things that I really had not been listening to as well as I probably should have
You're
in the
very
years leading
busy.
up to that. Yeah.
Yeah. And let's just actually just define so people have a framework. What
Yeah.
is Sjogren's,
Yeah.
disease or systemic Sjogren's?
So Sjogren's is also known as Sjogren's syndrome, although there is a big push to really know it as Sjogren's disease or systemic Sjogren's. It is an autoimmune condition. It is actually probably equally as prevalent as rheumatoid arthritis, though most folks don't recognize the name. And I joke that's because it sounds like a chair from IKEA. But it affects 90% of the folks that it affects are women, and it's hard to diagnose. So in about 60% of us, we will have blood markers that will kind of signal that the immune system is kind of misbehaving in this way. And primarily the immune system is recognizing and seeing a lot of our glands that create moisture in our body as the enemy, and also for many folks, parts of our nervous system as well. So a lot of folks will also have trouble with something called small fiber neuropathy or dysautonomia, where your automatic nervous system is going a bit haywire. So you may have increased heart rates or low blood pressure, things like POTS, which may be a little more commonly talked about now.
Yeah, and like in my case, gastroparesis, which is a
Yes.
disorder, the slow gastrointestinal motility. It's interesting because I should say before we go further that I've never been diagnosed with Sjogren's. I do have a lot of the symptoms, and as they say, sometimes autoimmune diseases don't like to travel alone. They like to have others hop along for the ride. But yeah, thank you for explaining that, because it really does. A lot of people have this misunderstanding that like if they do know what Sjogren's kind of connotes in their mind, it's like, oh, that's just that thing that where your dry eyes. And the same that
Yes,
people
I mean,
think
that's what I thought. For
yeah.
years, I knew the board question. The board question could be one of a couple things. It always was a woman.
Mhm.
And it included dryness. So dry eye, dry mouth, typically would be what would be in the question stem. And they also would talk about the specific autoantibodies. So the immune system proteins that are found in the bloodstream that signal, the immune system not seeing ourselves as safe, which are called SSA and SSB antibodies. But those are negative in 40% of people.
That
So
have Sjogren's.
that have Sjogren's. So that's a
Similar.
really significant number.
Yeah.
But the reality is over 90% of us deal with significant fatigue, a lot of body pain. We may or may not have inflammatory arthritis. That's a little more hit or miss.
Mhm.
Majority of folks will have digestion issues, whether it's trouble swallowing or trouble with, kind of irritable bowel type symptoms. And and then the nervous system issues that I talked about as well. Those are kind of the main things. And the other organs can be affected too, like the lungs, the liver. You kind of name the organ, it has the potential to go there.
So it's kind of like with rheumatoid arthritis, people think, okay, they might hear the word arthritis, they think, oh, it's just joint pain, but similar to RA, where maybe the initial kind of inflammatory process starts when your body creates antibodies to the synovial lining of your joints and tries to, attack that. It becomes then systemic, over time, and affects all the other organs. And so I like the idea of, personally, no one's asking me, but to put the word systemic into the Sjogren's name, because I think it connotes a more serious condition.
Yeah. And for a long time, there was this this concept of secondary Sjogren's. So could the Sjogren's be a result of your rheumatoid arthritis or your lupus? But really, the science has not pointed to those being true demarcations. And so that terminology is falling by the wayside.
Okay. And we are going to get to your story, because I think the personal stories are always so helpful. But as long as we're on this linear route of what is it? What are the typical symptoms beyond dry eyes and dry mouth? I mean, you mentioned fatigue, small fiber neuropathy, anything else that people, and then the autoantibodies, anything else like symptom wise?
I think, the big things that will come up that will clue me in to say, okay, should we check for this? More often when I hear that someone has been labeled as having fibromyalgia, but there's maybe seems to be a little more to it. I've spoken a lot with, there's another physician who is a Sjogren's patient, Dr. Sarah Schaefer. She runs this great website called Sjogren's Advocate. But she and I kind of have this unofficial kind of theory that she started, and I tend to agree with, that there are probably quite a few folks who have been labeled with fibromyalgia that are what we call seronegative, or normal blood work, Sjogren's patients, that will have, this difference in how we sense things, through with that small fiber neuropathy. You may have loss of sensation, or something called allodynia, where light touch is more painful. Also, the fatigue is, I think, one of the real characteristic symptoms that tends to be pretty pervasive. And then those other dysautonomia symptoms, so that I talked about, so slow digestion, or other irritable bowel type things, trouble swallowing, getting dizzy, or having inappropriately fast heart rates when you really shouldn't. Those are other things that would come to mind.
Yeah. And I know that some of the people with rheumatoid arthritis, because my audience listeners have a variety of conditions, or their families and loved ones. Like my mom, she listens all the time. Sometimes I'll call her. She's like, I'm on a walk, I'm listening to the episode with, this person. But, a lot of people are probably putting some wheels, the wheels are turning, because I know in my case, the first doctors I went to were the GI doctors, and I was having trouble swallowing, felt like there was a constant lump in my throat, dry eyes, dry mouth. And in addition to, the main problem was the digestion, because it was leading to weight loss, unintended weight loss. But anyway, so if you are listening and you suspect, who are the physicians that do diagnose Sjogren's?
Typically it will be a rheumatologist. The problem is, Sjogren's really has not really gotten much of the educational time in rheumatology training programs. So it is hit or miss, and there is a fair bit of needing for many folks to get sometimes second or third opinions. I also work closely in our department. Typically Allergy-Immunology is in with other non-surgical people. At Ohio State, it is this really cool collaborative environment where I am in the same department as the ear, nose, and throat surgery doctors.
That's
and
amazing.
So in the next hall over, and the reason that's important for me is, if I see someone that I'm suspicious about it, their blood work is normal, the next step in evaluation is to do a biopsy from the inside of the lip. And it is certainly not the most pleasant procedure, but it is a pretty straightforward procedure that they can do with just a little bit of local anesthetic in the office to further evaluate for Sjogren's. So that would then look for inflammation in the salivary gland itself.
Okay.
And then
Yeah.
neurologists are also commonly involved in diagnosis as well. Sorry.
Yeah. No. That makes sense given the symptoms. I mean, it's just, I know a lot of us who kind of went through a pre-diagnosis, but suffering, a suffering without a diagnosis period. Often it's very much like cathartic afterwards to be like, they should have known, but I know you as a physician, it's like your feelings are valid, but also we should take just a moment and recognize how difficult the diagnostic process is for any autoimmune.
Yeah.
Right?
Well, and what I realized was, I had this very small, narrow snippet of
Mm,
what I knew about Sjogren's.
yeah.
And really, you know, 99% of all that I know about Sjogren's now has really come after my own diagnosis. And
Mm,
so that is really what has, seeing how much privilege I had at, as a patient, being educated, having insurance, having a supportive spouse, having friends that are doctors, like
your spouse is
knowing
a
the
doctor too.
science,
Yeah.
like, right.
Yeah.
Like it, it's like the perfect recipe, right? But like, how can I use all that privilege to really and also still struggling to get, to figure out what was going on and to feel heard and seen. And so I really feel like it's my purpose to use that privilege to help others. And one of the ways in doing that is to help teach my peers what Sjogren's can look like.
Yeah. Yeah.
And to
I
think
think
of it.
that is so, first of all, everyone who has these, Sjogren's or similar diseases, we applaud you. I speak for everyone. No. And I think that's amazing that you're, cause you're a busy mom of 3. So you've got a lot going on. So I'm inspired that you take the time to be such a great advocate in the
Well,
Sjogren's space.
so interestingly, and I know maybe this is a segue into kind of sharing my story, but
Yeah.
it was within 2 weeks of my diagnosis that my now middle daughter, she was 9 months old and she was diagnosed with an egg allergy. She had a mild anaphylactic reaction to egg. And it was kind of this like, holy, you know what moment of like realizing that our family was very much just, in this just keep swimming mode and we were letting life kind of fly by and happen. We weren't taking ownership or having agency in making decisions and how we were living. And so, it's certainly been very much a journey since that time. And it was not rainbows and unicorns right away. But slowly but surely, I figured out, okay, these are my values. I want to make career decisions that align with those. And that in that regard has made it a lot easier to know what to say yes to and to feel a little less like about saying no to things.
Yeah.
It's so
Oh,
hard.
that needs to be we need an intervention, both you and I, because
I know.
we're both involved in a lot of things. And it's hard when you're so passionate, right? Then there's only so
Yeah.
many hours in the day.
Well, and you see how much need there is. Like this
Yes.
system is broken. I did like a little Instagram stories yesterday, and I was railing on essentially how in healthcare there's been a lot of vertical essentially monopolies that have been built between insurance companies and pharmacy benefit managers, all these different things. And I asked, what other questions do you have about the system? And one of my girlfriends from college, who will remain nameless, she's like, how could we just blow up the system and start from scratch? And I was like, great idea.
Wow.
I don't know though.
There are so many, systemic issues. And if you are so inspired, the national associations are often a good place to start if you want to really, because it's something that typically one person is going to be able to really move the needle very much on their own. It really is going to take like a team coordinated effort. So like I've gone to Washington, DC on behalf of like the Arthritis Foundation or, the American College of Rheumatology. They send patient advocates, and then that's easier because then they do all this research and they have lawyers and people that'll help you with like talking points. But yeah, it's brutal. It's brutal to find out. It's a moral injury, to discover that, oh, well, okay, all these doctors and amazing people have like developed these treatments. Okay, so I'll just get on the treatment, right? Oh no, the insurance is going to make me suffer more so that they can improve their bottom line. It's just evil, Why do they need more money? They've made record profits during the pandemic.
There's so much thought that goes into selecting a medication for a particular patient. Even something as simple for me as like an antihistamine. Like I'm thinking about, different factors. What is the patient's, what are their goals? Have they had side effects? Do they have other health conditions like liver or kidney problems that we need to think about metabolism, how the medicine is processed? Cost obviously factors in there. And a big part, a lot of times, is me every like January every year trying to figure out which which insurance plans cover which medications, because that unfortunately trumps almost all things. Especially as we look at these biologics, which are so prevalent in RA. We've yet to get them quite filtered over to Sjogren's yet, but there are quite a few that are promising and in like phase 2 and phase 3 trials.
Okay, well, that was actually, okay. I put a little note to myself, circle back to, what are the treatments for Sjogren's? And then we can circle back to your personal story because I want to learn more about that.
So for most folks, hydroxychloroquine, also known as Plaquenil, is kind of the go-to. And occasionally some folks will be put on methotrexate, though maybe not quite as helpful. And some of the other kind of DMARDs or, that are kind of the older school ones. The newer biologics that have been like revolutionary for rheumatoid arthritis, and then also several for lupus now, have not been helpful for Sjogren's at this point. Sjogren's also has a pretty significant risk of developing certain types of lymphoma, which are lymph node cancers. Thankfully, they are low grade, which means they are not likely to kill someone. But obviously, no one wants to be told they have cancer or have an increased risk of cancer, right? Like that is just about the scariest thing you can have when you do your little Google search trying to figure out what you have. But sometimes medications that are used to treat lymphomas and other rheumatologic diseases are used. So rituximab is kind of a bigger gun medicine, so to speak, that will be used in more severe cases. And that essentially wipes out the B cells that produce those autoantibodies or those proteins that are attacking the body.
Okay. Yeah. So those are the treatments that are actually going to like modify the disease on like a cellular. Well, okay, then we're going to go down. But then the lifestyle, what are some of the lifestyle or non-medicinal things?
Well, and what happened with me is, I'm kind of looking how I cope with stress and stressful things is like, we maybe deal with it with a little weird humor or, occasionally I'll go eat my feelings. But I also like to get a little more analytical and kind of like look, pull up the research papers. And when I realized that there wasn't much in between hydroxychloroquine, which, I had started, but also had been told it would take several months to kick in, and rituximab, which for context, I see people who, I have a skewed picture, but I will see folks whose immune systems maybe have not bounced back after they take rituximab and need immune system infusions like IVIG. So I see those folks pretty commonly, either maybe they got that medicine for cancer or autoimmune disease. So I have a skewed view of that med. I'm sure some folks who've taken it, many are like, it's life-saving, it's great. But I have only seen the bad things with it. So I was like, what is there in between? We know, and, I kind of knew that there was good data for like heart disease and, other inflammatory conditions to help decrease inflammation through eating a healthier diet, exercise, mindfulness. And interestingly, I was going back through, I was slowly this last couple of weeks going back through to see, get some things together to go up for promotion next year. And I gave a talk, like a journal club talk on a paper looking at the influence of diet on asthma control right around the time I was diagnosed. And so I think that probably was playing into my mind as well. Like, it's all hindsight, right? I didn't kind of think of it. And what was really cool about this article was it looked at the diet as a whole. It didn't just look at a particular vitamin C supplement or vitamin D level or taking fish oil. But there is increasingly data that would say eating a plant predominant or plant focused diet that's rich in various fiber is beneficial. And that, of course, has to be adjusted if you're dealing with gastroparesis or other, gastrointestinal issues. Like, you may not tolerate a high fiber diet. So that, that all has to be kind of personalized. Minimizing things like saturated fats. So fried foods, red meat, high fat dairy, those sorts of things. Things, of course, as a lifelong Midwesterner, I love. And movement. So trying to get some regular exercise, but not too much, because too much is actually a bad thing. And then mindfulness. There is like really good data to say that all the things that like maybe we sometimes think of as woo are actually really beneficial.
No. Yeah. I'm all about mindfulness. I mean, it took me a long time because I was very defensive about the idea that maybe stress could influence my disease because I've been told you're just stressed as like a way to get me out of the office. It's just anxiety. Then realizing, okay, now that I have a more like, open-minded relationship with and self-compassionate view of myself and better understanding of the disease process, it's really evident for me that adequate sleep.
Thank you. Sleep
And movement.
That's my biggest
and
one.
Stress. Yeah. Like lack of sleep moves the needle pretty fast on my joint pain and inflammation and high stress. Weirdly enough though, this is a total tangent, but just in case you have anyone else with gastroparesis or low appetite, when I'm stressed, my appetite's better. So I don't know what that's all about. Because it's like, it's supposed to be like, the blood goes away from your stomach and you're supposed to digest worse, but
maybe you're having a little increase in cortisol, which if we put people on prednisone, it makes them hungry. So maybe, I don't know.
Oh, interesting. Okay.
Food for thought.
Food literally. No, yeah. Yeah. So it's empowering for people to, I think, hopefully hear that there are the same kind of lifestyle modifications that help with rheumatoid arthritis. It sounds like would also help with Sjogren's.
And you don't need some, fancy unicorn tears supplement that someone's trying to sell you to do that. There is some data to support, vitamin D. A lot of us are vitamin D deficient, especially in areas that are, kind of have drearier seasons. Ohio, from like October to April, it's the season of gray.
Oh my God, you're talking to someone who lives in Seattle. Yeah, so understood.
Same.
1000%.
And then omega-3. So that is another one that there is some decent data towards. And then turmeric, like if, some of those spices, like they have potent anti-inflammatory benefits, just have to make sure you tolerate them. Okay. Some of those, like turmeric in particular, too much of it can kind of cause some GI upset.
Yeah. For me, it definitely it increases motility, which if you have slow motility,
exactly. That is a better way of putting it. Yes.
That can be a welcome change if your system moves too slowly. Absolutely. But if your system already moves fast, it may put you into too much of a good thing. Yeah. And then of course there's for the specific symptoms for specific areas of the body, like the eye drops and the mouth washes.
Absolutely. A lot of supportive care. So admittedly, I do not do a great job of putting eye drops in throughout the day, but I've found, of all things, a serum that helps my eyelashes grow, but actually originally was developed for dry eye, that I try to use most nights, that works really great for my dry eye. I think
what do you put it?
Too.
You put
It's
it
just
in
like a
your
little,
eyeball or on the
no,
skin
just
of
on the
it?
lashes,
Oh,
like,
okay. I was
yeah,
like confused. Oh,
yep.
wow.
And then a little on my brows.
Yeah.
Because I'm also, you know, I like always, one of the things I think that was so sad for me prior to my diagnosis was I realized my eyes were dry. I was no longer able to wear contacts,
Yeah, me too. That's why I
and
don't. Yeah.
mascara became really challenging to wear. And
Mm.
I was someone who never left the house without mascara. And
Oh.
it was to the point where I always looked like a raccoon
Oh.
because I was rubbing my eyes, right? So I stopped wearing it at one point for several years. And now that I've gotten symptoms back under control and found a product that has a lot less stuff in it, that's a topic for another day. The whole, like, the term clean beauty is not a thing, but
Oh, yeah.
there are some products out there that are tolerated better. Um, in particular, like looking for one, like I found one that was developed by an eye doctor, like, and her
Oh.
whole purpose of her company was she saw folks with a lot of eye symptoms related to their makeup and
Mm.
wanted to, provide something different for that. But
Well, that's really helpful to know because, yeah, for me, I do the Sustain Ultra
oh yes,
preservative-free drops,
yes.
which I
And
love. Yeah.
the eye docs will tell you if you are using eye drops more than 3-ish times a day, you really should use preservative free, because a
Mhm.
lot of times those preservatives can become problematic over time. Our immune system can kind of make a response to the preservatives.
Yeah. That's
Yeah.
really a good point about like examining your makeup products, especially for eye makeup or maybe even lip, because lip
Yeah.
dryness also, right,
Hmm.
can occur.
Absolutely. Yeah.
Yeah.
I'm obsessed with different, like, moisturizing lip product, like, because they are typically pretty dry. I mean, the other thing that's really important for Sjogren's is trying to take the best care of your teeth that you can. And
Oh, yes.
admittedly, I did not do a great job of that growing up. Like, we had well water, so the water was not fluorinated.
Oh.
And admittedly, my parents weren't super on top of us with flossing. Like, they were with brushing, they were with getting us to
Mhm.
the dentist, but I had a lot of cavities growing up. And then in medical school, I didn't have dental insurance for some time, and I postponed checkups for a couple of years. And during those years, I also was grinding my teeth because I was
Me
very
too.
stressed out.
Yeah.
So did considerable amount of damage.
Sorry.
But one of the first things I ended up doing before I was diagnosed or anything was my dentist said, "Hey, you got to give up diet soda. It's destroying your teeth."
Mm.
Um,
So it's not
and
the
so
sugar. Was it the fake sugar or is it the
it's the carbonation,
Oh,
in
okay.
large
Okay.
part, and
Okay.
in particular with sodas, it's pretty bad.
Oh, so I've
Um,
been drinking kombucha lately, which is
I know.
carbonated. So now I need to figure
I
out
don't know. I still have some sparkling water from time to time, but
it's not like, yeah, I
I'm
should.
also using like prescription toothpaste that has stronger fluoride in it.
Mhm.
I'm pretty religious about my flossing, um and my checkups too.
Yeah, yeah, me too. I go every 4 months and even more often if I need versus most people it's like 6 months, but I mean
Yeah.
that can be I think if those of you are like newer listeners, I have an episode with a really great like integrative dentist.
Oh, awesome.
Yeah, I'll send you her info. I'm having brain fog, so I can't remember her name right now. I'm sorry, that's
It's
rude, but I
okay.
can't remember. But she's incredible and she talked a lot about like the gut difference between your oral
Yeah.
microbiome, your gut microbiome, and developing rheumatoid arthritis. Yeah, she also is very like research based. So um, okay. Dental health, the oral microbiome, and rheumatoid arthritis with Dr. Victoria Sampson, dentist Dr. Victoria Sampson. Yeah,
Awesome.
I'll put that in the
Yeah. I'm
show notes.
curious if she was pro xylitol. Most dentists I've talked to think that that's an okay thing and can be
Um,
helpful.
yeah. I don't
There,
know
a
about
lot of the lozenges, like dry mouth lozenges and even dry nose
that.
spray. There's one called Xlear. They have xylitol in them, which
Mm.
I guess my understanding is feeds like good microbiome.
Yeah. My personal dentist had recommended it, but I just
Yeah.
Dr.
The only thing to watch out for is for some folks with IBS, it can be a trigger.
Yeah. It's like a
So
high,
just to be conscientious of it.
it's
It's a
on the
high FODMAP.
FODMAPs. Yeah.
Yep.
Yeah. When I was being treated for SIBO, I definitely, or SIBO, however you pronounce it.
Tomato.
Yeah. Tomato, SIBO, 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 SIBO. This is so helpful because I think, yeah, even, you know, regardless if you have a diagnosis, like, I guess this is something that some people get, this is a side note, but important actually. Like if you have already like a primary diagnosis of like rheumatoid arthritis, and you notice that you have these other things that may fall into a different diagnostic category. Like I remember I brought up Sjogren's to my rheumatologist, and at the time I probably should follow up with her because this was probably like 10 years ago. She was like, yeah, we wouldn't really change your treatment based on it. So, you know, if you're following up with ophthalmology, you know, every year you're getting, because I get the punctal plugs too. Oh yeah, we got to talk about punctal plugs, the teardrop plugs, you know, and she's like, we wouldn't do anything different, you know, but for me, it's like kind of has to do with your personality, I think, because I like knowing, you know, I think I kind of want to get the lip biopsy now just to understand myself better. But is there in your, as a doctor, not that you're giving me medical advice, but like, do you think it's, what should someone, if someone's listening, they're like, I think I might also have Sjogren's, like,
I think it's, well, if I definitely think it's at least worth mentioning to your team. And one of the questions I will ask my patients, and we think of together, is, will it change our management? And that includes how you think about things. And so I think that that is where that shared decision-making really comes into play. I've had patients go both ways and say, hey, you know, I would rather wait and see. I'm doing okay. I'll make some of these anti-inflammatory lifestyle things. And their symptoms aren't so severe that, you know, I don't think it will necessarily change management. I already have referred them and getting them plugged in with rheumatology just to make sure, because those are the folks that really should be on board. And then I've had other people that say, no, I really want to know. I'm totally okay with, you know, a minor in-office procedure. Like, let's do it. Oh,
sorry. That depends who you are. Yeah. Yeah. I was just, I thought that would be a question people are going to have. And,
absolutely.
and we will circle back to your story, but what if people want to learn more? Because it does seem like Sjogren's, you know, of all the arthritises, people feel like, oh, like psoriatic and ankylosing spondylitis are like the unknown ones. But then Sjogren's is like, of all the autoimmune diseases, Sjogren's is like one of the lesser.
We're like the ugly stepchild, and I don't know why.
Well, so I think Venus Williams did hopefully move the needle when she came out as having Sjogren's. There was some great, I remember seeing that. Like,
and also Carrie Ann Inaba and Halsey. Also those are our three famous people.
I didn't know Halsey, just, I know she has EDS.
Too. And suspected mast cell POTS too. There was, I think she had in her post a few months back.
But yeah, where can people learn more?
A couple of great websites. So Sjogren's Advocate that I mentioned is put together. It's a totally volunteer kind of work from Dr. Sarah Schaefer. She's another physician who is a Sjogren's patient, and she is a fierce advocate for us. I am a total fangirl of hers. She's an amazing human. Another place that's really helpful is the Sjogren's Foundation. So sjogrens.org, great, reliable information. The other, if you are dealing with symptoms of Dysautonomia International has some really great resources.
Or whether that Association for Autoimmune Disease, I always get that wrong.
Autoimmune
Association.
Well, Dysautonomia International has done some joint research funding for Sjogren's lately too, which made me like super excited because so many patients deal with both. And then I have, like, on my site, I have more of the lifestyle aspects. There's another doctor of psychology, Dr. Susan Masterson, who also has some really great resources too that are like more lifestyle related as well.
But what about your Sjogren's Summit?
Yes.
Can't forget that.
So April 1st and 2nd, we are, I'm hosting the 2nd annual virtual Sjogren's Summit. So last year, you know, we're kind of in the midst still of pandemicdom, right? Like we weren't traveling. I think so many of us were just craving human to human connection. And I especially was within the chronic illness community, and specifically the Sjogren's community, because I saw these really amazing pockets, and groups of folks with RA and POTS and mast cell, and wanting that for our Sjogren's community as well. And I loved what the Sjogren's Foundation was putting on. Every year they put on a really fantastic educational conference, which has tons of great information. That's another awesome event to attend. But I was looking for something that had more ability for that community to come together, for folks to interact more, in particular for medical professionals and patients to talk amongst themselves more, because I think that's the way that we're going to break down some of these silos between folks and build bridges. And I also was looking for something that was uplifting and empowering to say, okay, here's what we have, but what can we do to make the most of it? And so we're doing it again. I learned so much the first year.
Oh my gosh, no, this is such perfect timing because like I just finished up last weekend the second annual Arthritis Life Hack Extravaganza, similar thing,
fantastic.
It was so great. It was so great. And it was the second time doing it. So it's funny because people can know, okay, the first weekend of February will be the Arthritis Life Hack one. And then yours is, I don't know if yours is always going to be in April, but
that's I think that's the plan. This is, heard it here first. I'm also looking ahead. July is World Sjogren's Day. Oh. And last year we had over 1,000 people register.
Yes, that's amazing.
And folks from, I can't recall if it was 16 or 18 countries. It was like folks from all over.
Yeah.
And so my hope is that it continues to grow, and we're able to continue to bring visibility to, one of these invisible illnesses that doesn't get the screen time it needs.
Yeah. I mean, was there even a Dr. House episode with it?
There was one.
Oh, there was one.
I looked it up.
Okay, good. Okay, at least we got one. Yeah. But no, that's wonderful. I know it's fun, but I know it's a lot of work. You're better at from my knowledge of you, you're better. You're more advanced in your delegation than I am. So I'm working on that. That's my big goal for 2023 is to, I either need to do less or delegate more. I can't overthink it. That is what it is. Like,
we're human, right?
Yeah,
There's only so much we can do. I actually was trying to write up some wording because I want to invite Ms. Williams and Miss Inaba and Halsey.
Sorry.
Like I figured, what the heck, Why not? Worst case happens.
Oh my gosh.
I get no reply, or they're like, you're a jerk. But I wrote in there, I'm like, I realize you're human and everyone is probably asking you for something, but we would love to have you in whatever capacity you might be able or willing to join us.
You know what they could do? They could just even record like a 30-minute. Okay, same page.
Even just like a little, hey.
Did I say 30-minute? I meant 30 second. Like, yeah.
I would be so thrilled.
I know. That's okay. So I'm manifesting this into the universe is that so Dax Shepard has psoriatic arthritis, and he doesn't talk about it that much, but I'm a pretty dedicated listener to the Armchair Expert podcast. Good. So good. And he occasionally will just throw in something about it. He's on a diet for his autoimmune disease and I would love to have him involved with something, but he's so busy.
The thing, with the Williams sisters, both dealing with autoimmune disease, and Venus ended up creating a supplement and vegan kind of protein company. So she, certainly obviously has been very health conscious with her career, right? Mm-hmm. And also, although it wasn't discussed, the role of medical gaslighting and their care, certainly has come up. And I got senses from Halsey that she had probably similar
Oh no,
experience,
she's talked to it. Yeah.
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 And so, and I know, Carrie Ann Inaba has started a whole website like devoted to kind of health and wellness, and has talked about her more holistic
Mhm.
approach to her treatment, of her symptoms. And so
Yeah.
I'm crossing my fingers and trying to
That would be
manifest some
amazing.
positiveness too. I'm like, I
Oh,
think we
that's
align.
yeah. If anyone has any connections, contact Kara Wada. But yeah, okay. So let's
Grateful.
do this finish. I wanted to hear more about your personal story.
Yeah.
So after your second was born,
Yeah.
you started
Yeah.
developing these.
So yeah, Josie was about 9 months old. I had gone in for a dental checkup, kind of that first checkup after having her. And the hygienist was like, hey, your mouth tissues are really dry. And I was like, yeah, my eyes are dry too. I should probably get that checked out. And I kind of said it tongue in cheek at the time. But then I was like, I'm also just really exhausted.
But when
And
you
then
have it, when you go from 1 to 2 children, it's like, how do you know if it's
yeah,
normal mom
right. And
tiredness?
I also was in
Your
my
doctor.
first year. It was my first year of being an attending physician too.
Mhm.
And so, like that's also a big transition. Probably more so than, some of those other transitions through my
Mhm.
career and training. But what I was realizing is when I was sitting on the floor trying to play with Charlotte, who at the time was 3.5, 4, and Josie, as she was like moving around, when I would go to stand up from sitting like,
Mhm.
crisscross applesauce on the floor, I would be hunched over like my grandma for
Mm.
a good minute before I could like straighten back out. And it was so painful that I didn't like I didn't want to sit on the floor and play with them. Like I did, but I didn't, right? Because I knew I was going to pay for it later. And it
Mhm.
was kind of that combination of things coming together that I was like, I need to make an appointment with my primary care doc, and ask for some blood work. And, this is kind of where the part of like my privilege came in, like I got an appointment, thankfully, like relatively quickly. I knew what labs like I wanted to check, like kind of given my background, but I still had to like push for it. Like she's lovely, and I think she was just doing it to reassure me and not want, also not wanting me to have something wrong, but also like, I guess we can do that, like kind of like reluctant, right? And in in the meantime had reached out to a girlfriend, rheumatologist girlfriend who colleague that I love. And was when my labs came back positive, and she's like, it'll be fine. No problem. We'll see
Yeah.
you. We probably won't even put you on meds, but like, let's hear all the other blood work we need.
Mhm.
And then I saw her when my blood work is back, and she's like, yeah, about that. We need to put you on something. Like, it's not, like my labs were way off. And so things that also can kind of go along if if you're like wondering, and everyone's lab profile is a little different, but you can have a positive ANA, a positive rheumatoid factor, the SSA or B antibodies that I mentioned that are kind of the Sjogren's antibodies.
Mhm.
And then another thing that they will follow pretty closely in Sjogren's, are your complement levels, which
Mhm.
are proteins that essentially get gobbled up if your immune system is in overdrive. And so when those levels are low, it means that you are kind of chewing through that protein, you're using it up or consuming it. And that's not a great thing. And so those
Mhm.
levels were low. And I think that's what made her, if I had to guess, that's probably what made her a little bit more squirrely about my stuff.
Yeah. Yeah. It's a really fascinating experience, or kind of hard to put into words when someone has tried to reassure you by saying, you probably don't have this super, like, actually a
Yeah.
scary thing. And then
Yeah.
to be like, actually you do. Like
Yeah. And
I had
actually
the
we do
same
need to put you
thing.
on meds. And
You're so young. You probably don't have rheumatoid. Okay. Actually,
yeah.
yeah, you have like a really severe case that is like, we
Yeah.
don't even understand
Well,
how you're like walking. Like,
and then, here I am like trying to dig into like, okay, what, after the initial little mourning period, what else can I do? So being the type A A+ student, always. I was trying to do all the things, find this special secret sauce recipe to make it go away. And so I was like working out really hard on the Peloton. I was drinking green smoothies with my superfood supplements. I was doing all these things. Admittedly, still really stressed about everything. Right. Because that I didn't address yet.
No.
And
Us overachievers don't ever like to admit
no.
that.
And so then it's like, this is like May, mid to late May when I was diagnosed, so we're going through summer. And by Labor Day, I ended up with a severe inflammation in my liver that required a liver biopsy and the whole shenanigans. You never want to be the interesting patient. I'm sure all of you listening already know this, but you never want to be the interesting patient that they're saying, hey, let's send your liver off to the National Institutes of Health because we want to just, double check or kind of make sure of what's going on.
Oh my goodness.
And because this inflammation looks funky. But it turns
you never
out,
want to hear that's weird. Yeah.
Right.
From my dentist
especially
saying that
from,
before mid-filling, you're like that.
Especially from the junior faculty that was your on your team as an intern. Like
I cannot imagine. Or like, I haven't
He's
seen
phenomenal.
this before.
But yeah. So it turns out the supplement I was on, probably in combination with, my immune system not being normal at baseline, resulted in the liver damage, which has healed. Thankfully, the liver regenerates very nicely, but that was pretty scary.
Well, I think that this is another episode. I want to do an episode of how to not fall for a wellness scam because
we can talk about that.
That's a whole, I know you and I could talk for like 10 hours about this, and I'm not saying that the supplement you're taking was a scam. Like there's a huge continuum,
Yeah, absolutely.
Yeah, but a lot of people,
it had really great marketing.
Yeah.
Right.
And in your case, well, there's very few other things that are like available. Like, it's not like it's like, oh, you have these like 19 different like evidence-based medicines you can take, or you could try this supplement. Like, if you had that choice, you would obviously probably have chosen the Western medication or the medication that was
well, and I was on the Plaquenil or the hydroxychloroquine already, but it was kind of like, well, is this going to be enough? Like,
yeah. You're like, why not? It seems natural if it's natural. Yeah. Oh my gosh. I mean, but I just think it's very, I don't know if this is going to sound like patronizing. I'm a little older than you, but it's very brave of you to talk about that as a doctor, because I think there's a lot of shame amongst anyone who's gotten hurt by trying a natural method.
What I think, what frustrated me the most is when I reached out to the company, it was crickets. Right. And I think that's where, I come from sharing my story, is just that we need to be conscientious consumers, because unfortunately there aren't great protections in place. So we kind of have to do our due diligence as best we can. Right.
Yeah. I mean, then you've spoken eloquently on this before, but the supplement industry is not regulated. You have no idea what's in that. You have no idea. And at least with methotrexate, it's a known side effect. It's a known side effect profile. And that's scary to have to look it in the face that this might happen to you. But with a supplement, it's so unknown. Like, to me, it's like, I'm like a freaky person who's like more scared of supplements, basically.
No, I think that's actually where I am now, right? I still take a couple of things. Yeah. But I also am like extra particular, like, like it's stuff that has good science behind it. And that I like, for instance, like fish oil, vitamin D. And then, I admittedly was taking a hair, skin and nail type product.
Oh yeah. Like the biotin or no? So I don't know if you're allowed to say it.
I will say the name, but not to endorse it. I don't get any kickback from them. I've been pretty conscientious about that, but Nutrafol, which is one that at least talking with my dermatology colleagues, they kind of say, hey, this is like, if you're going to take one, there's pretty good science behind it. It's tolerated pretty well. And they have specifically a postpartum nursing safe version that a colleague friend developed the formulation for. And so having had postpartum hair loss and then kind of that stress hair loss after I had that big flare right on top of one another, I had pretty significant hair loss. And so I was trying to minimize potential for that happening, you know, over and above the normal after Ollie. So.
Well, and is there a name for what happened to your liver? Sorry, not to ask.
It was called an acute hepatitis, but it's like a drug-induced liver injury. Okay. And about 20% of liver injury is due to vitamins and supplements.
Really? Oh my gosh. I have a colleague whose child went into acute liver failure out of like literal nowhere, but he got a transplant and he's,
oh my God.
But yeah, it was the scariest thing. Anyway, you don't want to hurt your liver.
No, not that bad.
I'm not laughing, but just it's and I don't want to, you know, again, there are supplements that are more well-regulated. Like I take magnesium and vitamin D.
Oh yeah. Great.
And they're from places that, you know, my doctor's medical team, I make sure they know what dosage I'm taking and they are verifying, you know, so it's not, I don't mean to like slam all supplements. It's just, it's really important. Like someone criticized at the feedback form for the Arthritis Life hack extravaganza. They're like, seemed like you guys were all like, some of you were biased towards like medications. And it's like, if you're talking about rheumatoid arthritis in particular, it's like, I have a moral duty to like, I'm not a doctor, obviously, but if I'm giving you like general patient education, like I'm not going to pretend that there's equal evidence on both sides. It's not like
it's not.
Yeah. It's not equal. Like the supplements don't have the same volume of evidence. When they do, I will take them. And, you know, I'm the motivated to manage my disease the best I can.
Here's the reality too, when it comes to, you know, there's this perception that doctors pick particular medications because we get like a certain amount back from drug companies. We don't. No. Occasionally docs will, you know, maybe go to a pharma-based dinner for like education or partake in all of this is documented, and you can actually look all of this up or participate in research that is funded by pharma. Sometimes their medications are donated or what have you for trials and so forth. You can look that all up at CMS, which is like the Medicaid service kind of website. And you can look up my name and see that I did get some help with travel to the national meeting when I was a fellow from some company. I don't even know what company. Everyone got from a different company. But what you don't get in the vitamin and supplement industry is the transparency to say most of these folks are making somewhere between 30 to 50% commission on the products they're recommending.
Yeah, so they're not.
I don't get anything for recommending Plaquenil or methotrexate or Zyrtec.
Yeah.
Cetirizine. I generally say generic's good.
Oh, okay. Oh, sorry. No, thank you. I think this really is, I think if you don't take, you know, we can get into the weeds and be like, you know, what percentage of what causes what, but I think it's like at the very most basic level for patients. I think if you're confused or overwhelmed with all the different treatment options, I would just say, don't only compare the known side effects of a medication with the potential benefits of a supplement. Like you have to do a side by side, like of like and don't think that because something is natural, that it does not carry any potential harms, because, you know, poison is natural, you know, I mean,
arsenic, too much oxygen, too much water.
It's very hard to counteract the natural is better bias. And
it's I think there's something innate about that, right?
Yeah. Probably. And I think it's like there's a whole field. I actually very briefly studied it in my undergrad psychology, so not like even at a high level, but was like health promotion and health detection behaviors and the different kinds of framing, like gain framed versus loss framed messaging, like talking about toothbrushing, like if you don't brush your teeth, you may experience X negative thing. You may experience a painful, cavity, versus if you do brush your teeth, you will avoid the painful thing. It's like there's actually like different efficacy of different kinds of message framing. So those of you in like health promotion psychology, it's really fascinating. But yeah, it's deeply, I think it's the fact that you're putting something in, like, I think the other element when it comes to like methotrexate, because that's the one I think about a lot with rheumatoid arthritis. And it's like, let's just say not even about the natural supplements versus methotrexate. Let's just say methotrexate versus nothing. Let's say you're scared and you don't want to start it. And you're going to see if the disease just gets better on its own or through exercise or nutrition, vegan diet or whatever you want to do. When you put something in your mouth or you inject it in your body, you are thinking actively about the harm that could cause you and the benefit that could cause you. But when you're doing nothing, like you're not taking a medication, it's very hard to conceptualize that is carrying a risk. When you have a progressive,
like placebo versus nocebo.
Yeah. And I think people don't truly understand that rheumatoid arthritis is a progressive disease by definition. It will get worse if you don't slow it down. So you are risking.
And you can do permanent damage.
Yeah. Is Sjogren's considered progressive? Now that we mentioned that, sorry to go from.
Typically.
So okay.
It's a bit nebulous.
Okay. So first, it's kind of like, I know like with MS, it's like there's buckets, right? There's like the relapsing remitting, and then there's like the primary progressive, and then there's the whatever the other ones. So I'm not a doctor. I can't remember all that stuff.
Yeah. It's been a long time since I studied.
Well, anyway, so I'm sorry, we went on my favorite soapbox, not my favorite. All of them are my favorite children. These soapboxes that I like to go on with my amazing guests, but we should have another episode if you have time later, or maybe a panel discussion about how do we wrap our heads around, the wellness claims and,
I'm going to put you on the spot. Let's do it for the summit.
Yeah. I'm around.
And then we'll put it on the podcast or something.
Yeah. Because it's really about being able to run like risk benefit analyses. And for each person, it's different. Like in acceptance and commitment therapy, they talk a lot about like what's workable for you. Like, and it might be for one person, like I thought of an example the other day, because like one person might say, I love going to Whole Foods. I have the time and the money to go to Whole Foods and cook a totally organic, blah, blah, blah diet. And someone else might say, in the context of my life, I would rather not spend the time cooking and making the food and obtaining the food, however I can, not thinking about food. I'd rather take the medicine that could potentially theoretically achieve the same outcome. And there's nothing wrong or right about either one of those.
Yeah.
But but anyway, let's do it. And so, okay. Rapid fire time. This is the last thing before we can wrap. Is that okay? Do you have time?
Yeah.
Okay.
This is when I get to put my pageant hat on.
Yes. Yeah. Oh, put it on. No, if you want to. What would be some of your words of wisdom if someone's listening who just got diagnosed with Sjogren's? Like, what do you, little pep talk?
My first thing, and this is actually what we tell interns or brand new doctors, is to take your own pulse. Like, what are you supposed to do before you run to a code? You take your own pulse.
Does that mean like check in with mental
yourself.
abilities?
Take a deep breath. Just take a deep breath. Like,
I didn't know that was a saying. Sorry. That's really cool.
Oh yeah. Yeah.
I thought you meant like check your own pulse. And this is like me having a chronic illness. I'm like, oh yeah. Are you going to make sure you're not having a medical?
What I mean by that, for everyone is just to like, take a deep breath, and you have already survived the hardest days you've lived through, and you will continue to persist. And yes, there are going to be great days, and there are going to be real craptastic days. That was going to happen with or without this disease too. This is just, a new label. It maybe explains things that you have been wondering about. And just try to take a deep breath initially.
I think that's so important. Yeah. And remember that, your life wasn't more valuable before this diagnosis, and it's not less valuable
Yeah.
but there's so much
Yeah.
internalized ableism we have to fight,
Oh yeah.
thinking, oh, I'm less than,
Yeah.
I'm not superwoman anymore.
Mhm.
I still have that complex.
The other, like, in this is something that I think is just more of an overarching philosophy that's helpful for life. I am in the midst of listening to the book, The Gap and the Gain.
Hmm.
And essentially, it's this idea that in life, we can measure ourselves against the ideal or the perfection,
Mm.
or we can measure ourselves from, where we were and kind of more of that growth mindset, right? And if we
Yeah.
can stay in that gain, which is comparing, where we were and where we're going, being driven by, things that we want versus what we need and things, that rather than the gap between where you are and perfection,
Hmm.
that can be really helpful.
Awesome.
And
You already
it may not be ready. You may not be ready for that, right? Right after you're
Mhm.
diagnosed, right? But like just playing around with it or kind of experimenting with like, yeah, this totally sucks. Is there anything that is like even the slightest little glint of light in the darkness?
Yeah. Is there something I can learn from this or grow from? Yeah, I like
Mhm.
that idea. And do you have a favorite tool in your Sjogren's management toolbox?
My water bottle, which I don't have
Yeah.
right now. I have another cup, but I have this Awala water bottle.
Oh yeah.
Again, not sponsored. But it has like both a straw and it has like a spout. So it's great for working out. And I tend to gulp more water as opposed to sipping it. And so I think I stay better hydrated. It's also
Yeah.
metal, which I appreciate, like stainless steel as
Oh.
opposed to plastic, because I hate when it has that plasticky taste.
Yeah, yeah, that's a sensitivity a lot of people have. And then you mentioned The Gap and the Gain as a book that you've liked. Do you have a
Hmm.
favorite like movie or show
Oh,
you've watched recently?
I
Or
love
another book?
Emily in Paris.
Oh, that I know that those ads always get me. I haven't watched it, but
The
I'm like,
fashion
oh,
is so
yeah.
fun. And my husband and I got engaged in Paris. And so
Oh,
like the city has a little bit of sentimental like
that's so
draw. We were pre-pandemic, like years ago had said, oh, for our 10th wedding anniversary, we'll try to go back. Instead, we had a third baby. So
yeah.
we'll get back there. It just wasn't for our 10th.
Yeah, you'll get back there. Yeah,
Yeah.
yeah. Happy 10th. Was your 10th last year?
This last September.
So
Yeah.
ours was last
Oh,
May. That's so funny. Yeah,
yay.
yay, 10th.
Yay for 2012.
It's an auspicious year. Yeah,
Yes.
2012 was a good year. Yeah.
Mhm.
And then do you have a favorite like mantra or inspirational
Mm,
saying when things get tough or
that is a good one. I mean, this isn't like necessarily a snazzy quote, but what I've been thinking about a lot lately is that little bit, those little acts of rebellion that I would, do occasionally as like a teenager, or I see like that little glimmer in my 4-year-old's eye of like when she looks at me and has that like, I know you told me no, but I'm going to do it anyway because that's what I want, right? I I am trying to channel that energy and defy what people expect of me as an academic physician or a Sjogren's patient or a mom of 3 or a pageant queen or, a business owner.
a
And
nice
so
Midwestern girl.
yeah, I really have been having fun with this idea of trying to disrupt others' expectation and really mix things up a little bit.
You're a rebel. I like it. I like
Just
it.
just a little, like channeling a little bit of that energy because I think I had a meeting a couple of weeks ago and things didn't go exactly as expected or how I would have liked, right?
Mhm.
And it was just like, like it was all that much more incentive to like really do more, be more, like really see this vision come to fruition.
I love it. I love it. You're gonna like
Mm.
you have such a like sweet and kind exterior. It's like you're like covert rebel. I love like
Yeah, just a
like
sprinkle, like a
no, no,
sprinkle,
no. Yeah.
like
No,
And
I
pretty
think
much you get what you get, right? But there's this little sprinkle of, occasional sass, occasional, like pettiness, just a little.
I like it because it's about, embracing,
It's
I
human,
feel,
like human aspects, right? Like we
yeah.
all have our faults and
Well, and being an advocate requires you, right? Because you can,
Mhm.
being an advocate requires you to go, to say then this status quo is not okay. I'm advocating for something better. That is a rebellious act. And what's something that's bringing you joy right now?
Mm,
Mhm.
hanging out with my kiddos most of the time. Um,
All the
in
moms
per-
are like, yeah, I
yeah,
bet.
in particular, like with my girls, it's bedtime story. Like I
Mhm.
adore like reading with them, and doing silly characters and stuff. And then chasing after my youngest Oliver, he um I was and this is a little deep, but I was today reflecting on, like my body has changed considerably after I had him. I still, have excess, kind of 20, 30 pounds up from where I was before I had him. And
Mhm.
that weighs, like despite all the thought work we do, that's still like, is different, right?
Mhm.
And I was trying to think of how can I like flip when I go into these negative thoughts, right? And overthink things. Like how can I work on adjusting that because it's not how I want to feel.
Mhm.
But sometimes go into that circle. And so just like looking at his like joyful little face and like chasing after him, it's like, oh, this is fine. Like, and I know that I'm eating healthy and I'm moving, doing all these things I need to do
Yeah.
and letting go of those like, preconceived notions of what is, what I should be or what size I should be like that. I'm hoping that will, I think it will be helpful. Like just seeing that
Yeah.
little smile.
Well, and seeing the world through his eyes, like if you were 20
He's
pounds lighter,
exploring so
would it
much.
mean
Yeah.
anything? Yeah, like he
Oh
doesn't
my gosh.
care. Yeah, kids
No.
don't care what you look
Well,
like. Although it
he
might, yeah.
we're still nursing. And so if I were like forcing it and doing some of those, unhealthy diet culture type things, it's just going to impact our, that relationship I have with him. And I don't want that.
Hmm. But it's hard. That was in our Room to Thrive support meeting yesterday. That was a big theme of the ways that these rheumatic diseases or inflammatory autoimmune conditions affect, what your body mass, whether it's unintended weight loss with rheumatoid
Yeah.
arthritis, where you feel weak and small, or
Yeah.
unintended weight gain due to prednisone or just difficulty with activity. And it's hard. It's so loaded. It's such a loaded
Oh
emotionally
my
topic.
gosh.
So
Yeah.
yeah. Yeah. Thank you for
You're doing the work.
yeah, you're
Yeah. We're
doing the
all on
work.
the same, we're on the journey, right? Like,
Yeah.
we're all
Yeah.
coming.
Yeah. Absolutely. Okay. And the last thing, what does it, this is just a little meaning of life question. What does it mean to you to live a good life and thrive with rheumatic disease or autoimmune disease?
So, the book that I'm listening to just asked me to do this today in
Oh,
chapter 2. Really, for me, my focus on in this year in particular is making active decisions that are in alignment with my values. And I think that will be successful. So things that are going to allow me to spend meaningful time with my family, making, decisions that, are overall good for my health and well-being so that I can be there for them, those
mhm.
and and continuing to serve, the world with empowering education and building community, in particular within the Sjogrens community.
That's beautiful. I love it. I love it. Where can people find you online?
Yeah, so we updated the website. So it's drkarawada.com, and that's where you'll find all sorts of things where you can work with me, podcast. And I
Yeah, you
have,
have your own podcast.
yeah, the Crunchy Allergist podcast, which we're in the process of renaming as Becoming Immune Confident.
Yeah, I love
Because
that.
I think that better encompasses what we talk about.
Mhm.
And so over at the website, you'll also find I have a the Crunchy Allergist library. So essentially, it is a list of a lot of the books that I have read and have really influenced how I talk to my patients, things I do with my own like life and things. I got certified as a life coach last year. So some things kind of related to that, things that helped me in my lifestyle medicine certification. And so that is a great resource that y'all can hop over and download to get on the newsletter. I try to email like once a week or so, to keep people up to date on what we're up to. And then you should join us for the virtual Sjogren Summit, April 1st and 2nd. We're going to have essentially a pay what you can option. So if you're unable to pay, like you can get in for free. And one of my key values actually is transparency. That's one of my biggest frustrations with the medical field and wellness industries. And so we're calculating essentially how much it is for people, like to host it on the platform we're using, and then like the labor to go into it. So people kind of know how much it actually costs. And then if folks are able or want to, we'll be able to help, pay it forward to someone who is unable to pay. So those are, things that I'm really excited to, like I said, just trying to make those decisions that are in alignment.
I love that. I know there is something so, to me, strange about so many, and I'm sorry, I'm not calling out anyone in particular. It's just something I've noticed. A lot of people that are like kind of starting their own, I think 80% well-intentioned people, maybe 99%, not trying to scam each other, but like people are trying to do like their own health coaching business, or they have a system that they've developed that they think is going to help people with autoimmune disease. You cannot find what these things cost. You're like, what is the price? Like, oh, you have to hop on a discovery call with me to make sure that I totally get that for certain kinds of programs, like high ticket offers where you do want to make sure that the person's the right fit for you. But it's something to me I'm like, look, my Rheumatoid program like costs $400, or you can do monthly payments. Like I'm not going to just be like, hiding that somewhere. I mean, I took some, when I started offering like paid programs, I took some business classes and I got all the advice. If I said, oh, don't tell them what it is until you've created this insatiable desire for it. And this is just not me. That is not my personality.
And my stuff has evolved in that too, like you get this advice, but then you also like eventually start to stand on your own 2 feet. And realize like, oh, that doesn't sit right. Like, and if it doesn't sit right in your nervous system, your heart, your gut, whatever you want to call it, right? Like I've been trying to like let go of that and just lean into like, who am I? What do I stand for? And, take bits of the advice as, take what sticks and then get rid of the rest.
And that's true. And I should reframe what I'm saying to say that if that feels in alignment to you and your values and that makes sense to you, there's no problem with that. It's just, for me, it's like, as the potential client, I'm like, I am left feeling confused and concerned if somebody has buried the price of their programs and made it so that you have to talk to them before getting it. That to me, that doesn't resonate to me, and that I'm not that person's ideal client, so that's okay. People find who they are meant to learn from. So it's so funny. I keep seeing it. I'm like, oh, I'm just curious about this program. Like, because I might, I often will tell people, like, because my Room to Thrive is really a comprehensive overview, of the tools to manage pain and fatigue and the lifestyle factors, but it's not a deep dive into any one of them, so if you want a nutrition only program, if you want, like, I want to take 12 weeks and delve into that. Like I will refer people to specific programs, but I want to like know that it's something that's not like exorbitant for the person, or that it's, I want to be able to just understand the general pricing. And I'm like, why are you not telling me what your thing costs? I'm so confused. Anyway, sorry, little side rant. But okay. So thank you for your time.
Thank you. This is so fun.
Yeah, no, it's so fun. We have so much to talk about. We actually did stay pretty on schedule in terms of like content, what we talked about. But I loved their little side rant about the American healthcare system, and then the wellness kind of pros and cons. Like, obviously there's the reason so many people with autoimmune diseases turn to the kind of the wellness industry is that they're not getting adequately served by traditional health care. I'm sorry, 20 minutes every 3 months with a rheumatologist, no matter how angelic my rheumatologist is. She's literally an angel. She's like the most wonderful, beautiful person. it's not enough time.
No.
Like
No.
you can't set people out. It's like, what if you had cancer? Like, okay, just come back in 5 months. Like, you're like, what are they supposed to do?
Yeah.
Anyway, sorry, sideline. So you're doing
Yeah.
amazing work. I am excited for this Sjogren's Summit, and I will let you go because you have a million.
Yes. And we'll chat about how we want to do the panel.
Yay. Okay. Bye-bye for now.
Bye. Take care.
You too.